Hello, my name is Conor Gormally, and I'm presenting on behalf of my co-authors, Malayka Gormally and Elizabeth Sandel, MD, on Concussion Alliance's novel service learning undergraduate internship. Here are disclosures. And this is our class of summer 2021 interns. They hail from 5 colleges, 4 across the US and 1 in Ireland. And all 18 interns are participating in an 8-week, 30-hour per week remote program where they receive concussion curriculum and do service work for Concussion Alliance. Now, the creation of this program and our organization was rooted in our recognition of a need for more concussion education. Personally, I visited a sports concussion clinic for each of 4 concussions suffered between 2014 and 2016 with varying recovery times. But when my persistent symptoms didn't resolve spontaneously, for my 4th concussion, I found a lack of understanding from peers and teachers. And at that concussion clinic, my persistent symptoms weren't really evaluated for what might be causing them, starting this whole process of Malayka and I creating Concussion Alliance to find care for myself. Now, our work for Concussion Alliance has shown us how prevalent stories like mine are. For instance, a UCSF study that we covered recently in our newsletter found that 53% of concussion patients presented to US level 1 trauma EDs had significant disabling symptoms a year from injury. And so there really is this broad need to improve system of care for MTBI and concussion. Here's a photo of me from when I was in high school and still playing soccer. And so undergraduates are a great target audience for our internship because concussion rates among undergraduates in some studies have shown to be higher than among the general population. And concussion is a common injury in a high stakes environment like a college campus where there is a need for more advocates. Also, undergraduates are deciding on career paths and are open to new fields of study. And many of our interns are planning to go into medicine, psychology, research, and public health. So this concussion education and advocacy internship program creates advocates on 2 levels. Interns become advocates in their college and larger communities, and then they bring that advocacy into their postgraduate studies and later professional careers. So our first program in December 2018 was a 3-week program with 3 interns, which we expanded the next year in 2019. And then in 2020, we saw a need for remote professional development opportunities for undergraduates because of the pandemic. So we expanded our program to a full 8-week summer internship and recruited some of our former interns and our current volunteers to help run it. In December 2020, we took the structure that we had built from the summer and created a more in-depth and structured 3-week December internship with a larger cohort. And now in summer 2021, we have our largest cohort ever. These are our 18 summer 2021 interns speaking with the first guest speaker, Dan Fogarty, who's talking about the patient experience dealing with persistent symptoms of concussion and trying to find appropriate care. Alongside this initial guest speaker, the interns are starting to read Shaken Brain, the Science, Care, and Treatment of Concussion by Dr. Elizabeth Sandel, which is a core text for our curriculum. Throughout the program, interns also have the opportunities to have guest speaker appearances like Dr. Ron Savage discussing pediatric care and concussion organizations, or PM&R, Brain Injury Medicine and Shaken Brain with Elizabeth Sandel, Dr. Elizabeth Sandel, Neuroendocrine Dysfunction with Dr. Tamara Wexler, and more. So what is unique about our program that gives these interns a better understanding about concussions? And at the core of that is 2 weeks of dedicated multimedia concussion curriculum. Alongside Shaken Brain, interns read research papers, look at watch video conference presentations, listen to podcasts, and look at resources from across North America, both in the first 2 weeks and continuing curriculum throughout the program. And then expert guest speakers, whether from a patient perspective or renowned professionals at the top of their fields, inspire, educate, and connect with the interns. Even beyond that, we also set aside intentional spaces for critical thought, primarily in the form of guided discussions. We've also created a dedicated workspace for interns with an operations portal that contains weekly schedules and daily resources, which help keep the program running smoothly. And this summer, we've implemented pre and post internship knowledge evaluation to help us get more data on what the interns know and what they've learned. This internship also creates advocates and a sense of agency within our interns. And a big part of that is our projects. Being able to create resources where interns have identified gaps through the curriculum creates a real sense of agency. Interns learn about a problem that patients are dealing with, and then they're handed the tools to do something about it. And then beyond that, they also become advocates for their peers and family, with several interns reaching out to us when their peers suffer a concussion, letting us know what steps they took and checking to see if they could do anything else. And so we're finding, at least so far in the early part of our program, that this carries beyond our internships, the scope of our internship experience, with interns going on in their graduate and postgraduate studies and into their professional careers as real concussion advocates. And what is it about the program that makes interns more likely to improve standards of concussion care in their professional careers? I think a big part of it is that they receive about 90 hours of dedicated concussion curriculum across an 8-week program, supplemented by 12 hours of presentations from professionals in the field. And so interns learn about all aspects of multidisciplinary care, as well as barriers to access and care disparities. And we find that there is this profound empathy born of recognition and then an understanding of this injury that so far is carrying into their postgraduate and professional careers. So beyond all of the impacts for the interns, becoming advocates in their communities and bringing advocacy to whatever field of healthcare or public health that they go into, they're also in the internship creating state-of-the-art resources for concussion patients and advocates that are helping people right now. Pages like graduated exercise therapy, medication, headaches after concussion, what happens to your brain, cognitive behavioral therapy, mental health, post-concussion syndrome, and more. Additionally, interns are writing for the Concussion Update newsletter, which we publish each week during the internship. So they're learning how to write accessibly for both healthcare providers and concussion patients, and they're synthesizing the latest research as it comes out week by week on all different subfields of concussion care. Additionally, they have opportunities to remain involved, to continue writing for the newsletter, mentoring the next group of interns, writing web pages, creating training videos for new intern groups, or even becoming leadership team members. Special thank you to Malayka Gormally, Elizabeth Sandel, Cascadia Now, our expert guest speakers, and our amazing interns for making this program and presentation possible. Thank you.